What's up, everybody? I just wanted to get a quick foam rolling video in for you guys. I'm going to stick to the lower extremity, and then maybe I'll do a upper extremity one for you guys after this. But there are a lot of good properties to foam rolling. I mean, the most obvious one is the fact that you get the myofascial kind of release, the slight adhesions between the skin and the muscle tissue or the muscle covering or sinew. So anytime you can kind of get those adhesions between the muscle and the fascia and the skin kind of worked out, that should alleviate some pain and lead to some kind of smoother activities. So I have a foam roller here that I cut down, but it's just a way that I can get multiple ones out of one long one. I usually always start from, I say, like my ankles and work my way up to the hips, and then obviously if I'm doing a full body workout, then I'll continue from there. But basically, I'll start just up on my hands a little bit, raise my butt off the ground, and then just work my calves, the gastroc and the soleus. I'll do a couple. You can do together like this. You can kind of, if this is too much on your arms, you can kind of take the weight off it with the leg, so kind of here, and just do one at a time. You can get the medial head of the gastroc, you can get the lateral head of the gastroc, but I tend to like to do them together, and it works almost like a warm-up as well. You kind of roll, okay? So once you do that for anywhere between 45 to 60, 60 to 90 seconds, you've now worked your way up to, we'll just say, like the back of the knee. And again, same thing, I kind of choke up a little bit, and then do the hamstrings up to the ischial tuberosity and the glute. And you could do both together. You can kind of double stack and kind of just go on one. Double stack, just go on one. Again, 45 to 60 seconds, 60 to 90 seconds, depending on what you're really looking to achieve, or if you have a history of an injury there or ailment, then sometimes you might want to target that specific tissue a little bit more. Now, so the one that most people are probably here for is the IT band. This one is tricky because it's the most painful, but in terms of technique, it's really not much different than the others that I said. You can take a lot of the weight off with this back leg, and it kind of you just glide, steady pressure into the foam roller, but make sure you go up high enough. You really want to get up above that greater trochanter, that kind of hip bone, and get up onto the pelvis a little bit, all right? And then come back down. You really want to, and again, get to the full attachment or insertion of that IT band down on the shin a little bit. Go easy over the nerve on the outside of the leg, but for the most part, you're here. If this is no problem for you guys, then you can double stack, and again, just kind of walk the hands a little bit, nice even pressure, and then go from there. And kind of just try and find any spots. You can roll forward like I just did, or roll backwards a little bit and get the whole IT band. It's wider than you may think, so you want to get above it, you want to get below it, and then you can get into the hamstring a little bit and into the quad a little bit, and that really will help get the whole thing. So we did our calves, our hamstrings, our IT band. I'll show you quad, and then hip rotators. So again, when I do the quad, I actually start off kneeling on the foam roller, and then I just gently double stacked. If knees are straight, you'll get better depth in terms of into the quad muscle itself. But when knees are flexed, or the quad is kind of tightened, you'll get more of a superficial roll. So this is one way that I'm able to put a little bit of decent pressure into it. Again, if this is no problem, you can kind of roll down on just the left, roll up on the left, roll down on the right, roll up on the right, and you kind of just alternate them that way. So that's the quads. And then the other one that I like to show people, especially for like any type of sciatica or piriformis syndrome or anything like that, is you start off sitting on the foam roller. Let's see here. Doesn't matter which leg you do, kind of get into the figure 4 position. You can use this arm as a base of support. And really you lean towards the side that you're stretching, put a little bit of a stretch on that muscle, and this one's not much of a motion. You're just rolling back, rolling forward, rolling back, rolling forward, roll to the inside a little bit, roll to the outside a little bit. Also balance. Yeah, and then you kind of go from there. So I don't think it makes sense. If I show you this side, it won't show. So that's a quick little foam roll tip for you guys. The calf complex, the hamstrings, the quads, IT bands, and hip rotators or piriformis. All right. So I'll stay tuned for another one.